Unfortunately, in Minnesota, Lyme disease you're in the middle of a little bit of a political battle here. Our mainstream medical system, Mayo Clinic, University of Minnesota, are not very up on Lyme. And they're really just told, don't do it, we don't do it. You're probably going to get an eye roll when you ask your doctor about it. We've had doctors refuse to even test for it, which I always think is interesting. I've had a doctor, last year we had a doctor tell me there is no Lyme disease in Minnesota. Last year we had a medical doctor tell us there's only Lyme disease in Brainerd, because the ticks just never leave Brainerd, I guess. So we run into serious problems, even sometimes getting tested. Now, what's nice is we do have some research and some big names on our team now that weren't here 5 or 10 years ago. So you can look up Johns Hopkins Lyme disease, they have research teams. You can look up Columbia, they have a book, they have a research team. So now when I get somebody saying, well, my doctor said no, or Mayo Clinic said no, I just point them and go, well, you can argue with Johns Hopkins, or you can argue with Columbia, or you can argue with Harvard. Harvard has a $5 million research grant, got approved this last summer, researching Lyme disease. So you have some big universities starting to push this, which makes me very hopeful for the future. But unfortunately, right now, usually what happens is you go to your doctor and they run tests which are not high quality, which usually show up negative. And even if they are positive, they're really taught take 2 weeks of antibiotics and it should work. And the reality is if you do not catch this in the first 2-3 months, a 2-week course of antibiotics just really isn't going to touch this.